Which procedure would you recommend for acne scars, fine lines, large pores, and overall tired-looking skin? I have acne scarring and large pores and some fine lines starting, an overall tired skin appearance. What procedure would work best for me?
Thank you for your question. You submitted 2 photos, and you're basically asking what procedure is best for acne scars, enlarged pores, fine lines, and tired-looking skin. And certainly you've submitted 2 good photos to help provide some guidance as to what your situation is. Well, I can certainly assist you with understanding how a physician strategizes uh, a person's questions and problems like yours. A little bit of background. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and helping people rejuvenate their skin is something we get to do every day in our practice. And this is the type of question where you are going to have so many different permutations of answers because everyone comes to this from their own perspective and their own sense of priorities as to what is the best way to address the issues. So it's important when you meet with a doctor that you provide some guidance. Now, it is understandable. Very often people come to our practice and will say that they have these types of issues, and they'll just say, what do you recommend? So I basically try to help by breaking down what the problems are that may have a single procedural type of solution, and what are the problems that require some ongoing treatment. And then on top of that, when it comes to skin, maintenance is often a very important strategic part of the overall benefit that you can experience after you meet with a doctor. So when you think about it, when you deal with, let's start with the acne scarring. Acne scarring is one of the most challenging problems in the aesthetic field. And every year there are new light energy-based devices, different ways that always claim to be the best solution for acne scars. And yet every year more come out because they're not really as perfect as they claim. And I think that's an intrinsic problem with that type of strategy, is that an energy-based device or a laser isn't going to be a single solution, but it can be part of the solution. So when it comes to acne scars, the reason why I start with that is that very often it is a challenge first to have a good strategy, but it requires a proper diagnosis. So when I evaluate patients who have acne scars, I take very detailed photos. I look at them or examine them with something called backlighting to look at the shadows that are the result of volume loss of different levels of the skin. It's very important to diagnose the type of acne scars before you start with the strategy, because not all acne scars are the same. There are ice pick scars, there are boxcar scars, there are rolling scars, there are atrophic scars, and with all of them come a certain strategy to improve them. I've also noticed that there's a fair amount of freckling and sun exposure. So with that comes other solutions that do include lasers, as well as when you think of the fine lines, the sun-exposed skin, we think of skin that really needs some collagen. So a strategy that we employ for patients in terms of collagen building is we use something called platelet-rich plasma. Platelet-rich plasma is derived from your own blood, and it's a concentration of the wound healing factors that are necessary when you have a cut. Platelet-rich plasma can be applied through injection, can also be applied topically after a procedure like microneedling. Microneedling is a technique of using these fine needles to create fine little holes in the skin intentionally to do two things. One, to create a wound healing response, and two is to deliver something like platelet-rich plasma as well as other topical active ingredients to help improve the skin. So I think that it is important for you to get comfortable with a single physician who can guide you with all these different options. There are certainly infinite possibilities, but when I do a consultation with a patient, I always know that it is also important to understand what their capabilities are in terms of time and resources to allocate for all of the remarkable things we're capable of doing. And so I try to help them reach a certain ideal endpoint that will be part of a journey of continual treatment in order to get the optimal result. So and then one last part of this equation, of course, is skin care, skin products, and things that you can do at home. So a system has to be developed that you understand and understand what a treatment plan would be optimally for you. So it can include, as I mentioned, platelet-rich plasma for collagen buildup and skin quality improvement. It can include laser, whether it's fractional lasers, non-ablative lasers, non-ablative fractional lasers. It can also include microneedling. It can include also injectable fillers. So there are certainly a lot of different options to consider, and of course the use of topicals, including topical such as retinols, sunblock, as well as the good moisturizers and different other, and you can also add in peels for that matter. So with that being said, a photo is one part of the process, but the real answers come from proper examination. And you need to be comfortable with the doctor who's going to guide you throughout this journey. Very often, physicians and non-physicians are more about the transaction. They have a new laser, they want to use that laser for everything. They have a new device, or they have a single strategy that they apply to everybody. You have to get the feel for that from the doctor that you're meeting with, and if you're comfortable, begin your journey, and hopefully you'll reach a point where you'll feel like it was worth the process. So I hope that was helpful. I wish you the best of luck, and thank you for your question.